Hi, John Jesse with the Health Continuum with another in our Ask an Expert series. And today we're excited to revisit the topic of BFR with renowned expert Sten Stray Gunderson. Welcome back, Sten.
Thanks, John. It's really great to be here again. Thanks for inviting me back.
Well, we're excited to have you. Now, if you missed our first visit with Sten, he gave us a great overview of BFR, very informative podcast episode. You should go listen to it, and I'll put a link in the show notes. Now, Stan's an assistant professor of exercise science at the University of South Carolina. He specializes in human performance recovery and blood flow restriction training. You know, he spent more than a decade researching how BFR, intermittent hypoxia, and targeted cardiovascular training can safely improve strength, aerobic fitness, and overall health for people of all ages. And BFR can be a great tool in recovering from injuries. And that's what we're going to talk about today. But Sten, we better start with a quick overview, quick review of what is blood flow restriction and how does it actually work?
Sure. Yeah. So just to start, BFR is the application of bands or cuffs on the upper arms or upper legs in order to impede venous outflow and partially restrict arterial inflow to the muscle in order ultimately to accelerate fatigue and really generate adaptations that are similar to what we'd experience with high intensity or high load exercise. But the caveat there is that we're lifting lighter loads or doing lighter intensity aerobic work and yielding those same benefits.
Wow, it almost seems like cheating. So what you're saying is I put on these bands and I do so much work, but it's like I'm doing twice that work approximately or something. Is that really how it works?
Yeah, it's really how it works. It's accelerating that fatigue response to a given exercise. And the real key here is that we're using what would be otherwise trivial exercise for that individual. We're now ramping up that relative intensity by restricting that blood flow. And so it's sort of mimicking that high intensity or high load type environment within the muscle. And not only does this cause local changes, but the brain responds to this disturbance in homeostasis that's going on that's normally associated with this high intensity or high load. And the body responds as if it were high intensity or high load, releasing all those anabolic factors and creating growth and increases in strength and increases in blood vessel development, all that good stuff that we typically associate with exercise.
Wow. So I do my workout and my brain and body's going to respond as if I'm working twice as hard as I am. And I'm going to get those kind of gains with with a reduced likelihood of injury because I'm not lifting as heavy or wow. It's almost too good to be true. But you know what? I've been doing it for a couple of years and it isn't. Well, so it's great. Obviously, BFR is great just for regular training, but today we want to talk about how it can impact and help us to recover from injury. So what kind of injuries can BFR help with?
So all sorts of injuries, especially injuries that are focused on joints, any musculoskeletal injury, the main benefit, and I think rehabilitation is one of the really good targets for BFR training because it allows you're so limited by that injury in terms of the ability to lift heavy loads or be able to do high intensity work. And that's really where we have show the greatest progress or greatest growth or adaptation from exercise is really getting into those high intensity kind of type environments. And so especially when you're injured, where you're compromised, you can simply not perform that high intensity or high load exercise. BFR is a great way to continue stimulating those adaptations and accelerate the healing. As you may know, one of the things that comes with healing an injury are all these anabolic factors like IGF-1, for example, or testosterone or growth hormone itself that are disseminated throughout the body and aid in the healing process. The other kind of component here is that we're increasing blood flow. I know the term blood flow restriction, that seems like you're actually reducing the blood flow, but in actuality, the amount of arterial blood flow going in the muscle is actually enhanced. And also when you take the cuffs off, you get this, what we call reactive hyperemia, which is an increase in blood flow following this sort of restriction. And so in a lot of ways, it's helping promote more blood flow. The way we heal an injury is by getting blood flow to that injury and getting all the important factors involved in healing. And so whether it's a shoulder injury, a knee injury, a hip injury, back injury, BFR can really not only accelerate that healing response, but also continue to maintain or even grow more muscle. And so that's another real big key with a lot of these injuries is, it takes you out from being able to conduct the exercise that's responsible for maintaining that muscle. And so you go through atrophy. And so another really nice target of BFR is to prevent that atrophy in the first place. That way, when you get back to being fully healthy, you don't have to take any time to rebuild that muscle. You go from the starting point that you were at prior to the injury.
So that makes a lot of sense. So it's like I dam up this river during the restriction, and then afterwards, whoosh, I get all this blood flow, which is just what the joint or area needs to heal. And then it sounds like I'm also one of the problems with rehab is you don't want to re-injure it and you're kind of limited. But now I can do that limited work, but getting production as if I'm doing twice that still while I'm injured and keep from losing muscle mass. Wow. So that makes sense to me then.
Another important factor in all this is really the therapeutic effect of exercise. You know, personally, and I'm sure this is the case for you. If you go a few days without getting some proper exercise, you start going a little crazy and really needing that as a sort of a therapeutic effect. And so often in athletes, this is what we see. Athletes will get depressed, they'll get anxious, moody, and all these things, and they're really missing out on that normal exercise stimulus that they're used to getting. And so BFR allows you to get that stimulus in a really short amount of time in a safe way to not aggravate that injury and still get that mental health aspect of the exercise as well.
Yeah, I've learned over many years, Stan. I have about 2 to 3 days without working out, and then I go into a depressed state, and
Absolutely.
it doesn't take long. So I can imagine that, and I bet a lot of these high end athletes have a hard time not doing it, and then they do, and they get injured, and so wow. It makes sense that this would work. Now let's kind of talk through the specifics, okay? Pick an injury and talk us through the protocol, the exercises, sets, reps, and cautions. Maybe you could do a couple of joints. Okay.
Sure. Yeah, we'll start with the knee. I think that's something that speaks to people. But just about everybody has some sort has had some sort of knee issue over their lifetime. And so, a couple things. I like to kind of start with principles, and then we can kind of get into specifics. So one of the principles is that the cost associated with doing blood flow restriction is far reduced from when you would do a high intensity or high load exercise. And so you're really able to actually conduct multiple BFR sessions per day, and that is going to really augment the healing process of that joint. Another really important factor is the swelling going on in that joint, especially the knee, and it's in particular the meniscus, which does not get a lot of blood flow in general. And so by promoting this restriction of blood flow and actually sort of almost forcing blood into those nooks and crannies, if you will, of the joint of the knee, we're able to promote more blood flow and repeatedly stress the muscle and all the connective tissue with a good bout of BFR, and especially going to fatigue, we're able to really augment that healing process and prevent any atrophy, as I said before. So one principle to come out of that is, you can do this stuff twice a day, or every day throughout the week, and really help not only your physical health, but also your mental health, as we just touched upon. Now, getting into specifics, there's various kind of protocols that you can employ, and I would encourage people to do sort of all of these different types to see what kind of works for them. So if we go by sort of the textbook literature definition, usually what people have landed on is one set of 30 reps of a given exercise. So this could be body weight squats, this could be single leg lunges, or sort of half squats, depending on the severity of the injury. If we're talking about the knee, and then resting for about 30 seconds, and then conducting 3 more sets of 15 reps, each spaced out by about 30 seconds in between those sets. Now, this is just a sort of overarching protocol. Doesn't mean you have to follow that to a T. In fact, as long as you're getting into a robust fatigue state by the end of the second, third, or fourth set, you are inducing that BFR effect that we're looking for. And oftentimes, what ends up happening is I typically employ a 4 or 3 set of 15 repetitions, and what ends up happening by the end of the third set, people are usually hitting 12 to 13, maybe even just 10 reps of a given exercise. Again, depending on the type of exercise you're doing, whether it's single leg or bilateral type exercise. And by doing that, we're really trying to maximize that fatigue signal. And that fatigue signal is really critical for inducing this anabolic effect and really driving muscle adaptation. So that's kind of one on the more resistance training side of things, protocol.
Now let me ask you. Let me say on the knee, we're not putting the strap down by the knee, even that's a joint working. We're still putting it up higher towards the top of your thigh, correct?
Correct. Yes, for both the arms and the legs, the proper placement for any given muscle group is going to be as high up on the leg, kind of where the glute meets the hamstring. I like to tell people, and then on the arms, it's going to be right where the bicep meets the delt.
And that's always the case. No matter what we're working out, we
Correct.
always put the straps in the same place.
Correct. There's a reason for that. So, first of all, that you have your major femoral arteries on the inside of your legs, and this is primarily what we're restricting, including in addition to the saphenous vein and other deeper veins within the legs. And the reason not to put it around the knee is we have much more superficial nerves that are around the knee and blood vessels that are around the knee, which again, if you're putting it around that area and tightening it too hard, you may cause occlusion. And so we want to avoid occlusion and any kind of potential nerve injury by keeping them in the right placement at the right time.
And if I'm doing just one rehab my right leg and I'm doing squats, but I'm going to put them on both because, right, if I'm doing full squats, I would put them on both. But if I'm just doing single leg exercises, I just put it on the one leg.
I would recommend putting it on both legs, no matter what you're doing. And I would actually, even though you're working your injured leg, I would work both legs during that exercise session. If you're extremely short on time and you can only get the injured leg going, I would still put on both bands and work the injured leg. And actually, this is something we talked about previously on the podcast. After the first few sessions, I actually recommend putting on all four bands at once. That includes the arms and the legs at the same time to get a very robust stimulus. And this is actually a nice segue into the sort of aerobic protocols that we could talk about. For any aerobic protocols, I highly recommend putting on all four bands at once because you're having a more systemic amount of blood flow restriction going on. I think people often forget that our entire circulatory system, as obvious as it might sound, is connected. And so when we put these little, impairments in flow in certain points, it affects the whole system.
So Stan, now I was doing that and I thought, well, maybe I'm not, I'm just, when I go for my bike ride or my run, I'm just going to put my legs. Now you tell them I got to put those arms back on. My goodness, it makes for a hard workout. But boy, the gains are great. It's like, yeah, okay, I'm back. All four bands on aerobic.
I think get used to the BFR stimulus first. Don't kind of go. You wouldn't go into a gym if your goal is to lift 500 pounds. You wouldn't go into a gym and try to lift 500 pounds on day one, right? You want to kind of build up that tolerance just as you would with anything else.
I did four the first time, and man, I was shocked that it took me a couple hours to recover from what wouldn't have normally. So yeah, I've learned my lesson on that. Yeah, build up like anything. That's what the health consultant tells you. Is a little change of time. All right, that's great for the knee. What about an upper arm, like a shoulder?
Yes, same principles apply. So this is something you can do multiple times a day, every day throughout the week. Again, this is a fairly aggressive strategy to try to heal that tissue and prevent any atrophy or even cause a little bit of growth during this time. So kind of that multi times per day or at least every day is going to be really important, especially in those early stages of rehabilitation. Same sort of thing applies that we talked about with the knee. So you can do those 3 to 4 sets of anywhere from 15 to 30 reps. Generally, you're going to be able to do more reps in that first set. It's almost like a pre fatigues, and then your numbers will kind of come down as you hit that fatigue. I like to call it sort of the fatigue pocket. Okay, so and everybody, if you've done BFR, you kind of know what I'm talking about. You kind of hit that point where you're starting to get a good muscle burn. You're starting to get fatigue. It's becoming much harder to continue that exercise movement. You're starting to having to recruit maybe other muscles to actually continue that exercise. So getting into that fatigue pocket is going to be very critical. And typically that happens in the end of the second, third, or fourth set. So kind of repeatedly hitting that will be good. Some exercises that you can do for the shoulders in general, the posterior side of the shoulder, the back side of the shoulder is going to be critical for shoulder rehab because that provides a lot of the stability. So things like rear delt flies, or even if some rotational movement where you're kind of keeping your elbow and shoulder in line as you're pulling against a resistance band, kind of working the backside of the shoulder. Things like overhead press, if your injury can manage it, as long as it doesn't cause any sharp pain. A little bit of dull pain is okay, but sharp pain we want to avoid. That's indicating that we're actually aggravating that injury. So another really big key here is to use light weights, and because you're going to accelerate that fatigue using really, really light weights, and you don't want to aggravate that injury, make sure you're using light weights during this time. So similar to that kind of knee example, we're doing 3 to 4 sets of that 15 to 30 rep range and using about I didn't mention this in the knee exercises, but you're using about 20 to 30% of your 1RM. That ends up being about people's body weight for the most part with the lower body. With the upper body, you can get away with doing those things with a 2 to 5 pound weight.
And normally with a weight resistant training program, you're looking at, you do your workout and then you want a couple of days rest for it to all build up. I heard you say with this injury recovery, you might want to do it even a couple, 3 times in one day, and you can actually even do it daily to get all this blood in and get the healing. Is that correct? I
Yeah,
understand you correctly.
100%. And part of that is you can kind of tailor the actual session to the fact that you're doing multiple sessions per day or multiple sessions per week. So you don't have to do 5 exercises for your shoulder to rehab it. You can just get away with 1 or 2 exercises for that given session. Maybe you do that in the morning, get the synovial fluid going in the joint, get those muscles nice and fatigued, get blood flow into that muscle as well as the joint itself. And then later on that day, do another couple exercises. Again, within each exercise, you're doing 3 or 4 sets, but this takes about 5 minutes. And not only will it help accelerate the injury, it'll help the pain management associated with that injury as well. We know from a lot of documentation that BFR can induce a hypoanalgesic effect. And so it helps reduce your pain sensitivity. And so that alone can really help you manage the injury a bit better and just make
Wow.
your daily life a little bit easier.
The more you learn, the better it gets. Let me just go through a few different places in the body. So I've got bands right about here, right at the top of my arm. Elbow,
So
does it help?
are you saying
Yeah, I'm gonna ask if it does can it help with elbow?
yes, absolutely. So, and one thing to keep in mind here is you it helps with all muscles involved in that given exercise. So, just because so both below, we call it distal to the cuff, or even proximal or above the cuff, you can talk about your shoulder or even your pec muscle or your traps. All those muscles will benefit. It just depends on the exercise that you're doing, right? So, go
So
ahead.
if I'm doing an upper body and I've got a upper back injury, that it should assist with that. And even as it goes down to connect even to my chest, then are we saying that it can have impact there too? Correct?
Yes, absolutely. Again, there's sort of 2 schools of thought on how that might work. The first is that as you're fatiguing sort of the distal, the muscles below the cuff, you're having to rely more and more on the muscles proximal or above the cuff. And so that's sort of one idea. And then maybe in concert with that, you're also stimulating this neural humoral response, which is generating a cascade of events that lead to a release of healing factors and growth factors that then go to the sites where the muscle was worked and it goes to heal that tissue. Again, because the intensity of the exercise is relatively low, the actual damage associated with that is fairly low. And so you have this almost super compensation of healing factors that then goes to that tissue. And the injured joint receives a lot of that blood flow carrying those healing factors as well to again kind of augment or accelerate that healing process.
Okay, a lot of lower back injuries for people, especially
Mhm.
as they get older. Is there any help with the lower back with blood flow restriction?
So yes, I've seen this anecdotally. I would say there's less evidence in the literature on lower back injuries as opposed to knee injuries or elbow injuries or shoulder injuries. But in my anecdotal experience, it has majorly helped with lower back injuries. And again, it comes from this idea that the entire circulatory system is connected, the entire musculoskeletal system is connected, and so fatiguing a given area while it's under this blood flow restricted state is going to really augment blood flow. It's going to, with that blood flow, going to carry a lot of healing factors associated with rehabbing that injury. And in particular, the lower back is interesting because heavy weight typically, especially things where you're loading the spine, that will really aggravate the lower back. And for a lot of people, it's just not doable. And so even just having no load on the spine other than your actual body weight during like a body weight squat. Another great thing to do is some rotational movement to really get some not only movement within the back, but some strength in any and addressing any asymmetries that you may have. A lot of the exercises that we do in the gym are in the sort of sagittal plane where you're kind of in a very linear mode. What BFR kind of allows you to do, in addition to those sagittal planes, is work in the transverse plane where you're able to actually rotate and get those stabilizing muscles fatigued. And that fatigue allows for, again, more blood flow, but also stimulates them to be able to get stronger and adapt in that way as well.
Wow, amazing. And we really appreciate you sharing your expertise. One last question. So some people are, I'm sure, wow, I want to get started on this. I'm going to go get me some BFRs. There's several places now. It's a lot more available and cost effective. Company you're associated with,
Be strong.
Be Strong, great product.
Let me say one thing. I think as far as BFR cuffs out there, I would only employ all 4 bands at once when using the B Strong bands. I would actually tell people to avoid all 4 bands at once if they're using a blood adapted blood pressure cuff, as the restriction can be a little bit too intense. But because of how the B Strong are developed in their kind of within their design, there's a non-occlusive sort of sealing, which means they're not going to occlude the arteries at all, and they're thinner, so they don't cause as much discomfort. And so you're able to actually do all 4 bands at once. So my caveat there with my previous comment about doing all 4 bands at once, that really solely applies to using B strong bands.
The Veep strong bands. Okay, that kind of leads us to my last question. And people are probably thinking, "Oh, I'm going to get these," but I know there's a small percentage of physical therapists who use it. They mostly all know about it, but for some reason they don't implement it. But can I safely do this at home, or do I need to go see a professional and get professional help? What do you think?
It's a great question. You can totally do this at home unsupervised. What I would say is it would be good to, we have different webinars and different content out there on YouTube or various other platforms where you can kind of get an idea within the product itself. There's an app and diagrams for to help you actually place the bands on properly, which pressures to use, and that sort of thing. My initial recommendation to people is to start out at about 200 millimeters of mercury for the arm bands and about 250 millimeters of mercury in terms of pressure on the leg bands, and then kind of work your way up or down from there. If the exercise is, if you're reaching fatigue within 5 to 10 reps using a low weight, it's an indication we'll lower the pressure slightly. If we're not reaching fatigue with our given pressures, that's an indication to increase the pressure by about 25 to 50 millimeters of mercury as well. So it's something. It's sort of a node that you can sort of play with depending on your experience with it. But across all of those pressures, 0 to 500, we're not going to actually occlude the artery or stop blood flow ever. And so all of those pressures within that range are going to be safe. It's just a question of how fast are you actually accelerating fatigue, and how much discomfort associated with the band rather than the discomfort from the muscle burn do you want? And you really want to focus on discomfort from the muscle burn, not from discomfort from the band. So I always tell people you actually need a lot less pressure than you might imagine to accelerate that fatigue response.
Okay, so you can do it at home, folks. You want
Yes.
to follow the instructions from your provider and one step at a time, like Sten says, a little bit at a time. That's terrific, Sten. We'll put in the show notes some links so they can get some more information and pursue this. We hope some of you will. I know I've rehabbed injuries. Sten's rehabbed injuries. Some of the highest performing athletes in the world have used this to rehab and get back on. But you're just as important as them, and we hope that you can do it. Sten, one last comment before we wrap it up.
Yeah, I'd be remiss if I didn't mention very briefly some aerobic protocols. So very briefly, we talked about the resistance training protocols, but from an aerobic standpoint, whether it's on a bike or if you're running on a treadmill or outside, my general recommendation is doing intervals anywhere from 2 to 5 minutes. And these intervals aren't what you typically think of as high intensity intervals, right? They are at a relative intensity of maybe 40 to 50% of your actual max VO2, your VO2 max. Okay. So maybe you're pushing 100 watts on the bike or even 75 watts on the bike for 2 to 5 minutes. And you can repeat that up to 6 times. So anywhere from doing three sets of that or three intervals of that intensity for that duration all the way up to 6. And as you get more and more trained, you can even push that up to 10 sets of that. But again, just wanted to put that out there. I think that's a very up and coming area of research in the BFR world, where we're now looking at the aerobic benefits of BFR training as well.
I've been doing it for a while, and I'm just a personal uh, researcher with an N size of one. I'm absolutely sold and convinced that it is a very powerful tool. Less work, more benefit. So that is terrific. Well, folks, Dan, thank you so much for your time and your expertise, and we'll put those links in the show notes so you can look that up. As always, though, we need to ask you, what are you able and willing to do today to begin to improve your health? One strand, one change, that's all it takes to begin your road to improve health and fitness. Maybe blood flow restriction. And please don't forget to subscribe. It helps spread the word. This is John Jesse with the Health Continuum. Have a happy and healthy day.